is Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up-chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Pukeology.
So you want to have sex again, right? Well, first off, congratulations on having that bouncing baby. All right. I know that you guys have all done incredible things during your pregnancy to make sure that you have a very healthy baby. But let's talk about sex, baby, right? The salt and pepper version, because pregnancy and giving birth after the actual entity can actually help to change sex in a way. And I don't want to say for a good or for a bad, but during this podcast, you're going to actually learn a few things. Number one, you're going to get how and why you need to wait a certain period of time. And what are those things? How can you actually cause the vaginal muscles to tighten up? So again, you'll hear a lot more from me, your favorite Pregnancy Pukeology podcaster, Dr. Pukeology. And I did want to throw out there, so are you pregnant? Do you want no more morning sickness, pregnancy nausea, or how about no more headaches or migraines? Visit our sponsor, nomonausea.com, the only natural way to instantly stop your worst upset stomach, nausea, vomiting, and headaches now. Get a code 25% off with the code PUKE25. That's PUKE25. Or just place your No More Nausea band on your baby registry for your delivery bag. Now available at Bye Bye Baby, or get it shipped for free in just 2 days with Amazon as your favorite Prime vendor. And know that your little ones are always taken care of with No More Nausea Kids and No More Sleepless Nights Kids, now available at your local Walmart store. Do you want to hear some pregnancy humor that may just make you want to pee your pants? Like you don't have to pee all the time anyway, with hilarious stories like poop shot, bouncing barf, and up-chuckle. So if you want to learn more about your pregnancy and delivery, humor and knowledge is the best way to help you survive these 9 months. And just know we're in this together. Today, you will learn the science behind why you as a pregnant woman and now as a post-delivery need to wait some time before having sex. Secondarily, you'll end up learning what are those key features that may change and or childbirth causing problems after you've had a baby. And then third and last but very not least, you'll end up getting great suggestions from your favorite pregnancy doctor as to how to tighten up those vaginal muscles. And by the way, ladies, since my little baby girl, again, she's 9 now, but it still works even after you've had a baby for a very long time. Again, that's what you're about to get in Pregnancy Pukeology Podcast, episode 87. When can I start having sex again after pregnancy?
The science of puke, pukeology.
So how does having a baby affect sex? Well, pregnancy and delivery, again, you experience both of these and your body has changed significantly. Well, what about your sex life? It probably has as well. And it probably feels very different after having a baby. Recent studies show that delivery may actually make a woman experience sexual problems, particularly in the first couple of months. Especially the first 3 months, ladies, that's when your body is basically getting back to normal. Remember, it takes 9 months in order to make a baby. So again, give yourself or your body at least 9 months period of time before you're too hard on yourself. Some women report to experience the following problems of sexual issues or problems after delivery. Number one, dryness. That makes the vagina and them experience pain, ulceration, especially whenever they're having sex. Number two, vagina becomes very thin and loosely elastic. So the elasticity issue. Elasticity is basically how big and how small. Remember, you just pushed a watermelon size out of a donut hole. Again, women who also get perineal tears or episiotomies during birth, they find having sex soon after delivery very, very painful. And that's because we, as medical doctors, we will literally slice that area in between in order to help the vagina to be able to deliver such babies. And then the fourth and final is low libido. bleeding, fatigue after birth, those all reduce the desire for sex after delivery. So changes of your hormones in post-delivery are responsible for these changes that you experience. For example, estrogen, a hormone that is responsible for lubricating the vagina. This decreases after birth, making the vagina feel very dry. As a result, you experience irritation and or bleeding when having sex. So while having a vaginal birth makes your vaginal muscles stretch, you need to kind of take a break and allow it to heal prior to going back at it, right? In addition, you may need to have a longer recovery period of time if you've had a perineal tear or an episiotomy during delivery. And we actually have multiple different grades of what we call perineal tears. So again, if you are having any type of question when it comes to perineal tears, go take a listen to Pregnancy Pukeology Podcast, episode 35. It's called Perineal Tears. And literally, you will actually see the different vaginal grades of them. And this is how we end up classifying such things as such. All right, so again, you may be thinking that if you had a C-section, oh, don't worry about your sex life, right? My vagina stayed intact. That's actually not necessarily the truth. You will be bleeding thereafter having birth, regardless of which way. Remember, everything is full of blood. So again, your body naturally increases the amount of blood that you are producing, hence why you get very swollen. Some women are literally like everything is swollen from one side to the other, especially in their ankles and things of that nature. And if you've had high blood pressure during your pregnancy, that is something else that will actually increase the actual fluid. For example, if you have had a C-section, and again, the truth of the matter is things change after sex. So I will tell you that you will all experience the same hormonal changes that people with vaginal deliveries or women that have vaginal deliveries versus C-sections will. And you also have an abdomen that needs to heal, meaning you have just been cut from one side of your hip to another in order to get that baby out via vaginal C-section. I will tell you, I have had two. My first one, I had a normal vaginal delivery. And then my second one, I ended up having a cesarean section for an emergency C-section. So I can tell you both ways. And to be honest with you, my C-section was actually much more difficult. Your vagina is made to take a beating, all right? I don't have any other way to say that except for that. But again, when you're doing that, I had a much shorter recovery period of time versus my C-section was very, very painful. So again, in the aftermath, I believe that I was back in the sack a lot sooner with my vaginal delivery as that I was with my C-section. But so how long should you wait after delivery to have sex? So here's the need to know. The truth is there's no set timeline that you have to be able to jump back into sex after delivery. But the vast majority of healthcare providers will normally recommend, so me as a doctor, I usually say to wait 6 weeks before having intimate relations with your partner, regardless of the mode of delivery. So again, whether it's a C-section or a vaginal, that's 4 to 6 weeks is that sweet spot of time. I honestly encourage women 6 weeks and above, especially if they've had a C-section. This is to allow time for your body to heal and to stabilize your hormone levels so that you don't experience vaginal dryness, bleeding in that area, and or other sexually related problems. Also, you must avoid having sex the first 2 weeks postpartum or post-delivery because that's when the complications are highest, meaning you could actually be harming yourself and putting inside your body literally different bacterial infections. I'm not saying that your husband, your partner are dirty by any means, but you really want to limit the exposure that your body has to these type of outside infections that could be delivered through your mouth, right? And also through the vaginal canal. So, where were we? We were where this helps to prevent. So if you do wait, it helps to prevent different complications such as postpartum hemorrhage and infection. So again, postpartum hemorrhage, usually we will see it if there was any type of retained placenta, and retained placenta is where pieces of the placenta is what feeds the baby during your actual pregnancy, and sometimes little pieces get stuck, like we don't get everything out or it doesn't come out intact, and that can cause massive amounts of bleeding. Usually we would see that while you're still in the hospital for 2 to 3 days after delivery, so you don't really have to worry about that as much, but infection is definitely something that I want you to kind of take a look at. And someone actually just in the live feed talked about hemorrhoids. Absolutely, right? Hemorrhoids are something that we women unfortunately will get. Why? Because we're bearing down. So that bearing down on everything and the massive amount of blood flow that you actually have, especially in the area of your booty hole and or your anus, that area itself will actually get engorged. Sometimes you can have internal hemorrhoids and then external hemorrhoids. So very good point. Checks for that as the listeners are listening live and sending me different feedback. So again, there is definitely a definitive amount of time that you should wait to resume to have sex after delivery. We said 4 to 6 weeks. I encourage 6 weeks and above, and you got to take things slow, right? You need to allow your body to gradually adapt to sex life until you feel comfortable engaging in sexual activity, again, after giving birth. So will sex post-delivery hurt? So I know you're sitting here and you're wondering, it causes some discomfort. And so the answer is yes. I'm not advocating drinking or taking a shot or two, but again, as an analgesic, it will kind of help your body to say, okay, I'm feeling a little better, and make sure that you have a lot of lube on deck. Okay, so the hormonal changes after birth may tend to make your vagina a lot drier, tender, particularly while breastfeeding. So again, you have prolactin, which is what ends up increasing the amount of milk that your body produces. And so those hormones counteract your other amount of estrogen hormones. And that's also the reason it's not 100% effective, but that's the reason why your body has a reduced chance of getting pregnant while you're breastfeeding. Doesn't mean it always happens. There are people who have Irish twins, meaning they have 2 babies within the same year, or again, the babies are a year apart or whatnot. So again, this does help to reduce the fertility because your body wants you to be able to heal, and it knows that it won't be able to control getting comfortable, right? So giving the baby, the next baby, the new nutrients that it needs. So it does decrease your fertility. Again, the only thing that is certain or 100% a birth control method is just not having sex itself. Now, the pain might worsen if you had a perineal tear during birth. So if you experience discomfort or pain but still want to have sex after delivery, here's some things that can help. You ready? Use lubricants, especially if you experience vaginal dryness. Tell your partner what you feel, especially about penetration during sex. And then you can try alternative things that are sexy, right? I know getting a massage is very, very, very enjoyable. So it doesn't always have to be a sexual encounter in a, penis type vagina. It can also be other things that are very sexually stimulating. So take actions to relieve any type of pain. Try to make sure that you pee before you have sex, ladies. So again, empty your bladder completely, and maybe taking preemptive painkillers. So that's like Tylenol, ibuprofen, things of that nature. And try having like a nice warm bath before having sex. This will really help to loosen all of those muscles thereafter. All right, that was a lot, right? So let's get to some really hilarious puke stories that may just make you want to pee your pants.
Throwing up on a Tuesday? One puke story.
I honestly did not know that it was super common to poop while giving birth. I guess they left that part out in Lamaze class. I was focusing on my breathing while I smelled the most foul smell during contraction. We had a mirror, so my husband started dry heaving when he saw the soft serve brown stuff. Once I started dry heaving, and then I got sick, and anyone and everyone who was around me all started smelling the vomit. The good news is that intense push from the vomiting actually helped my little girl get out quicker. Thanks, Marie Mama 7, for that hilarious puke story. Now, I was trying to wait for the epidural, and I thought I would give the birthing ball a shot. My wife was super supportive as I was doing squats next to me to help me. I guess I shook up my bowels while I was bouncing, and she said I looked up at her with these wide eyes and started throwing up all over the place. I hope that they sanitize those balls really, really well. LOL. Thanks again to Ashes for that hilarious puke story. My anesthesiologist was so hot. So I was trying to be the best patient I could be on the planet. I got into position. The epidural was placed awesome. I didn't even feel my next contraction. I laid down and almost instantly started vomiting all over my gown. He said it was okay and it was a normal response to low blood pressure after inserting the epidural. But I still wish that he would have told me that. I was so embarrassed that this Grey's Anatomy lookalike saw all my dinner from last night, but I called him in a few minutes just to get a good look again. Thanks again, XTinamama 28. Do you have a hilarious puke story and you just can't wait to share it? Send it to me, Pukeology, Pukeology @nomonausea.com. That's NOMONAUSEA.com, or tweet me @Pukeology so we can all have a good laugh.
Tips and tricks to stop the up-chuckle that you need.
So now we get to the good part, right? So we already talked about what are all those problems that you might have. And now let's get to the really fun part where we talk about how to strengthen your vaginal muscles. What can you do? Well, there's a lot of things. Strengthening your pelvic floor muscle is a way to strengthen the vaginal wall. It's important to know that your pelvic muscles are a part of your core that supports your bladder, your rectum, your small intestines, and your uterus. With age, and after childbirth, your pelvic floor can actually become a little weak, leading to accidentally peeing on yourself and feeling a little bit like a constant need to pee and or pain in your pelvic area or experiencing pain during sex. Has this ever happened to you? I know that it's happened to me. I was a college cheerleader prior to becoming a physician, and I could do toe touches until, the cows came home. Well, now if I'm on a trampoline and I jump and do more than what's called a triple, it's where you do 3 in a row, I get little tinkle all the way coming down my legs. So this is an exact way of, as a personal experience, that I'm able to talk to you guys about it, because I'm not just the doctor here. I have been pregnant 2 times. And so I can tell you from personal experience, these are things that are going to help you. So there's 4 amazing ways to help to strengthen your pelvic floor. And think of these exercises as exercises for your vagina. Do you have a buff vagina? If not, let's talk about it. Number 1, Kegel exercises. Try to find the right muscle that I want you to, okay? It's the muscle that you use when you're trying to stop peeing, okay? Imagine your baby is crawling and just got into like the cleaning cabinet, right, with hazardous materials. You're peeing on the toilet, so what do? Because you haven't baby-proofed your drawers. Highly recommended, but doesn't always happen. And again, what you are going to do is you're going to literally stop peeing immediately to go grab the baby, right? And then grab him or her, and then that's your Kegel muscle. So again, what I want you to do is right now, we're going to use it. Ready? Here we go. So you're going to squeeze that muscle all together with me. 1, 2, 3, squeeze. And you're going to hold it. So again, you're tightening your pelvic floor and you're holding it for 5 seconds. Now relax. Okay. Relax it for 5 seconds. Now, again, me moving it by the chair, clearly my pelvic muscles are not that strong. But again, a lot of times most women choose to do pelvic exercises and or Kegels while they're laying down. Okay. I'm sitting. So again, I don't know, I do them while I'm driving. This also helps to get you a little friskier whenever you do come home. So again, you can time it to the beat of the music. You'll start to learn that this is a muscle, right? So again, if you have if you listen to techno in the car, you're really going to come home very happy to your husband and or wife. But again, just try to do Kegels while you're bored, while you're sitting typing at a computer if you're working from home. And this way you'll also be helping to tighten that pelvic muscle so that you won't have as much tinkle come down your leg. Number 3, repeat steps 2 and 3, okay, at least 5 times in a row. So again, ready? Here we go. Squeeze your Kegels for 5 seconds. And relax them for 5 seconds. And do that. You can start to increase the amount of time. So instead of 5 seconds, make it 10. But make sure that you're not tightening your thighs, your abs, or your butt, only your pelvic muscle. So really focus in on your hole, literally. Okay. So again, best results for a vaginal workout, you should do 3 sets of Kegels, 5 to 10 times per day. So again, try to do it 5 to 10 times, and then again, each set or rep. It is a real workout for your vagina. Number 2, pelvic tilt exercises. Doing Kegels is great, but you also have to strengthen your pelvic floor. So Kegel is really only going to strengthen the actual vaginal muscles that are here. And then your pelvic floor is literally your pelvis, okay? So stand with your shoulders and butt up against a wall. Pull your belly button in towards your spine, flattening your back against the wall. For the ladies who have a big booty, also known as sway back. Hey, I'm Latina. There's nothing I can do about it, right? It may be harder to actually get your back to touch the wall. So get as close as you can. And I speak from experience, all right? I do have like a tilt to my back actually. But again, you want to perform these pelvic tilts exercises 10 times for up to 5 times a day. Anytime, just do them in between like commercials or something while you're watching TV. Number 3, vaginal cones. These are actual called Kegel balls. So vaginal cones is like a very medical way of saying it, but you take a weighted lifted tampon-sized object that you put into your vagina and you hold it with no hands. Do it with no hands. Okay, that's the whole idea. So you literally are holding a weight that's actually in there, so that causes you to have to tighten it even more so. Okay, weightlifting for your vagina. It's a thing. If you ever want to waste a lot of time on the internet, just look up Kegel weightlifting. It is incredible. There was a chick that literally had a surfboard. She was lifting a surfboard with her vagina. It was absolutely incredible. She gets all the kudos in the world because she clearly heard this podcast and she understands. So usually they come in sets of 3 to 4 different sizes, each with heavier and heavier weights. So when you task each of the ones that are like the lower weight class, then you can get up higher and higher. And I think they go up to 2 pounds, maybe? I'm not really sure. You got to check out the actual kit, okay? So the way that you do this of vaginal weightlifting with these Kegel balls is that you insert the lightest cone into your vagina. Try to insert it without lube because you are going to try to hold it. Lube will actually make it slip out, so you don't want to do that. Instead, try to do no lube. Be very gentle as you go in. Squeeze your vaginal muscles and hold it in place for about 15 minutes twice a day. So you're literally holding it for a long period of time. Increase the weight of the cone as you become more and more successful holding it, and challenge yourself, right? Try to do a ballerina squat, legs out, and literally like go back and down. This way that you're actually engaging all of your vaginal muscles all at the same time. So again, you also have the last part is neuromuscular electrical stimulation. Most people have heard of like a TENS unit. They use it for their back, but they wouldn't think about using it down there. And so what happens, what a TENS unit does is it contracts with electrical activity and then relaxes and then does it again and contracts. Well, you have muscle down there, right? Again, go very, very, very low, please. If not, you'll like zap off your vagina. So you want to make sure that you are contracting your vaginal muscles by sending a signal through the body that innervates the muscle by sending electrolytes that cause the muscle to contract. It's called the NMES device, is no different from the signal that's coming from your body or from an outer source. A vaginal probe, this is done by a medical professional. A vaginal probe is inserted into the vagina that sends an electrical signal. This causes the pelvic floor to actually contract and then relax. The session, you can actually have a session for it. It lasts about 20 minutes in the doctor's office, and if prescribed the NMES unit at home, you should do this for 20 minutes once every 4 days or for a few weeks at a time. So your vaginal muscles will change over time. There's only 2 real factors that you can affect how tight you are down there. The vagina's elasticity, which is dependent upon age, and childbirth, frequent sex or lack thereof, because it won't cause your vagina to stretch, be stretched and relaxed, and those stretch receptors. Stretch receptors are real. Most people find it crazy that your vagina has a stretch receptor. Well, how do you think that it comes back? So it does a snapback, right? A bend and snap. So again, think of all of those aspects or things of that nature. So women who have had more than one vaginal birth are more likely to have weakened vagina muscles due to a stretch that needs to be led by your baby to pass through the canal. It is normal to feel that your vagina is slightly looser after having a vaginal delivery, but your vagina will snap back a few days postpartum. It may not return to its normal shape due to suturing or stitching by your doctor, or internal tears can cause the muscle layer and they could potentially get larger on one side or the other. So notice what I just said. If you were sliced or cut and you're sutured, what happens is one side might compensate for another. So you actually might have one area that's bigger than the other. It's kind of like whatever side you hold your baby on, that's like the big time muscle that you end up getting. You get this nice strong muscle on one side, and then the other side looks very weak. Same thing can happen to your vagina and the muscles that are actually down there. Remember, your vagina is full of muscles, and it is no different than if you tear any other muscle in the body part, and your body does it as a protective mechanism to make it stronger. A pulled muscle, what does it do? It knots to get tighter and knots to get tighter. Same reason why you lift weights when you are exercising. So have you ever pulled a muscle like on your hamstring, for example? Okay, it's super painful. But what happens is when your hamstring is hurting, the other muscles around it have to compensate. So this is the reason why I'm telling you to do all of these muscles and exercises as needed. Believe it or not, the non-affected side will actually get larger because it is doing more work on your vagina in the same way, so that one labia or one lip of your vagina may get larger after your beautiful baby is born. The vagina's elasticity decreases as you get into your 40s. Sorry, ladies, not really that much fun, but I will tell you, #it's true. As you become perimenopausal, your estrogen levels start to drop, meaning your vaginal tissue becomes thinner, drier, less acidic, and less elastic or flexible. For all these reasons, make you feel like your vagina is looser than before. I would highly recommend a good vaginal probiotic. I know I personally take them, and they are phenomenal, as well as making sure that you never douche or put anything up there that doesn't need to be, right? Just cleanse on the outside, nothing goes in the inside. Your body is a self-contained total system. Alrighty, and then the last but not least, vaginal wetness, right? Like, how do you increase vaginal moisture? Vaginal wetness comes from both the Bartholin glands, which are 2 little pea-sized glands that are located on the inside of the vagina, and on the cervix. The cervix produces a mucosa and fluids as a response to hormonal changes in a woman's menstrual cycle and during ovulation. Hence why you want to have sex more during this time of the month, because you also have way more fluid of blood itself down there, okay? Both produce moisture when the female feels aroused during sexual activity. The vaginal wetness should be clear. It is, if it's not, there could be many other potential reasons and or complications. If you're curious what color, right, is inside of your underwear, you really need to take a listen to Pregnancy Pukeology Podcast, episode 22. It's called Vaginal Discharge and what your vagina is really trying to communicate to you. There's different colors for different things, and I will tell you, go see your doctor, right? As much as you may say that I'm your favorite TikTok doc, favorite pregnancy podcaster, right? Pregnancy doctor, or however you want to say it, you do need to be in constant communication because different colors of items that are discharged could mean you have potential STDs, different type of infections, bacteria, vaginosis, or things of that nature. So, number one, stay hydrated. Okay, how do we increase the amount of fluid that your body makes? Stay hydrated. Decrease your intake of caffeine and alcohol because both of those are diuretics, meaning it will deplete you of water concentration that you have inside of your body. Number two, get healthy fats into your not facts, but get healthy fats into your diet. Adding food rich in soy, flaxseed, vitamin E, they will all help to restore estrogen levels and estrogen hormone levels in your body, thus increasing your vaginal moisture. And three, come more. Yeah, you heard me. The more you come, the more excited that you will be. Notice that I didn't say have sex more. There's a big difference. But again, if you happen to tell your husband this, you're welcome. Okay. So again, come more. And the reason why I'm saying that is you need to stimulate your mind and your vagina to allow yourself to get wet more often. Your body will respond better with practice. If you get turned on by watching the boys of Baywatch or listening to a little Usher or playing with your spot when it comes to your G-spot shaped toys, this will help to speed up the process, right? Just do it. So bottom line is, having sex with your partner after sex is a very intimate moment. It can be challenging at first, especially within your first couple weeks after you give birth because you have a baby that's crying and the last thing that you want to do is, attend to that instead of sleep. So there's no definite amount of time that you should wait, but I do recommend at least 4 to 6 weeks to allow your body to heal. Remember to take things slow and feel as comfortable as you possibly can because it's worth it in the end. You have a beautiful baby. Now you know the science behind, when you're supposed to be having sex after birth. What are the common complications after giving birth when it comes to sexual intercourse, such as vaginal dryness, pelvic floor issues, and last but not least, how to help stop them, right? How to increase your wetness. You now know how to make your vaginal muscles way tighter. So again, I want to thank you for listening to Pregnancy Pukeology Podcast number 87. When can I start having sex after giving birth? So to ultimately give you the best answers and informations that I have about pregnancy that there is to date. If you love me and Pregnancy Pukeology Podcast, please let me know. Give me 5-star ratings or hearts for likes, but most importantly, share it with all your Prego friends. Thanks again for listening to Pregnancy Pukeology Podcast, episode 87. When can I start having sex after giving birth? See you next time.
Pukeology Podcast, edutainment at its finest.